Thanks for joining, everyone. My name is Megan Grantham, and I'm a chiropodist or a foot specialist, and I work out of Cleveland Clinic, Canada's downtown location. So I hope that everyone did their homework last week, and we'll have your running homework at the end of today's presentation. If you have any questions or any concerns or any kind of pain or injury questions, please feel free to reach out to Beth or any one of us, and we'll answer your questions the best we can. So we're going to get started. Today's presentation is on running shoes. So I think that we can all agree that running shoes are easily the most important piece of running equipment. And that's because proper running shoes can prevent pain and injuries. So with all the different varieties out there, it's hard to know what to choose, what to pick. There's so many brands and different features out there. So hopefully after this presentation, you'll be able to make more of an informed decision and feel comfortable. So some of the kind of key factors in choosing your running shoes is where and what surfaces are you going to be running on? What type of support do you need? And then other things to consider are cushioning and what we call heel drop height. So that's what we're going to look at. So the most common type of running shoe is a road running shoe, and it's designed for running on sidewalks, roads, treadmills, and tracks. It's light and flexible in design, and it's made to cushion or stabilize the feet during repetitive strides on hard and even surfaces. Road running shoes generally have a flatter, smoother sole to create a consistent surface for running. The next type of running shoe available is a trail running shoe. And trail running shoes are really designed for off-road routes with rocks, mud, roots, or kind of any other uneven terrain. They're generally heavier and have stiffer soles, and with thick and bulky treads, sometimes referred to as cleats, for better grip. Also, sometimes they can be fortified with plates under the foot to help protect your feet from sharp rocks or objects. The other type of running shoe is what we call a cross trainer. So cross trainers are really designed for gym workouts, cross training activity, or any kind of balance activity where you want to have more contact with the ground. They have an extended outsole, which helps with lateral kind of side-to-side movement. And really, you shouldn't be running in these type of running shoes. These are meant for in the gym. They're not meant for running any sort of long distance. So what you want to consider once you've chosen your type of running shoe is the level of support. Now, there's generally 3 different kind of categories. Someone who supinates tends to have a foot that rolls outwards when it hits the ground, and they tend to have more of a higher arch, which means less shock absorption because they don't have that pronation. This means that there's actually a greater risk of lateral ankle injuries. And I should mention that very, very few runners and very few people actually supinate. But the way that you can tell is that generally there's wear patterns on the entire outside of the shoe. Now with someone who's a neutral pronator, your foot kind of rolls inwards, let's say a typical amount. Everyone's foot pronates or should pronate to a point because you need pronation to absorb impact and reduce pressure to the ankles, knees, and kind of the joints of the lower limb. This is kind of considered a normal foot, and it's biomechanically efficient. And the way that you can tell if you're a neutral pronator is that you'll tend to see wear patterns on your shoes on the outside of the heel, as well as in the middle of the forefoot. Now, we kind of go to the opposite spectrum of supination where we've got overpronation. Now, this is where your foot rolls inwards excessively. It tends to have a lower arch or a flatter type foot appearance. And there's an increase in risk for overuse injuries, so tendonitis and strains to different muscles. You'll be able to tell if you are an overpronator based on the wear patterns that would be kind of all along the inside of the foot, or inside of the shoe, I should say. Okay. So to help with that support, there are kind of three different types of running shoe support. So the first is neutral, a neutral running shoe, and that's designed or can work for mild pronators, but it's best for neutral runners or people who tend to supinate. They typically don't have any kind of the motion control features that you're going to see in some of the other two styles of shoes, and they're kind of lightweight and a bit more cushioned. Now, the stability running shoes, these have stability devices that actually help to control pronation or opposed pronation. They often include guide rails, which controls side-to-side motion, and they're good for runners who exhibit mild to moderate overpronation. These shoes are not quite as rigid as the next shoes, which are the motion control running shoes. Now, the motion control running shoes are the most stable of running shoes, and they're meant to counter or moderate severe overpronators. They're best for runners, like I said, that overpronate severely, and they have firm posts that reinforce the arch side of each midsole. They have a stiffer heel, and they're designed on a straight last, which someone that has an overpronated or a flatter foot tends to have a flatter outside of the foot, so the straight last actually hugs the foot a bit better. They also have internal construction, such as like a stiffer heel and a denser foam. When we talk about cushioning, there's really, again, there's three, technically there's four, but there's three that you'll see the most in stores. Now, the moderate amount of cushioning offers like the thickest padding in the midsole for that kind of ultimate plush feeling. Runners that have high arches, bony feet, or arthritis should consider wearing a more cushioned shoe to really reduce the risk of injuries such as fractures. The moderate cushioning is kind of that balance between that pillow soft comfort and thin or very little cushioning. And this is kind of where you'll find the most variety of shoes in this category. So most of the running shoes that you'll see have moderate amounts of cushioning. Barefoot and minimal are shoes with minimal amounts of cushioning, obviously. They're favored kind of by runners who want to feel that connection to the ground beneath them, but they're generally recommended for racing, shorter distances, and greater speed running, so speed work, because they promote more of that forefoot strike. Heel drop height. So most people wouldn't be aware of the fact that this is in a running shoe. So the heel drop of a shoe really represents the difference between the cushioning in the heel and the cushioning of the toe, and it's measured in millimeters. So a traditional running shoe generally has about an 8 to 10 millimeter drop. The lower the drop, the more the shoe is actually designed for a midfoot strike. And when you think of a midfoot strike, that's not your nice, long, slow, easy run. That's more speed related, shorter stride. So this is something to really factor in when you're considering your running shoe. What type of kind of strike do you have, and what kind of risk are you going to increase if you go to something that has a lower heel drop height. So for those of us that generally wear dress shoes, high heels, or kind of standard walking shoes, or for those who are already running in a traditional running shoe, any change to a lower drop height should actually include a transition period in order to prevent any injuries to the Achilles. If you think that you're always wearing high heels and then all of a sudden you're running in a pair of shoes that have a really, really low heel drop height, the strain on your Achilles is going to increase exponentially, and you're going to put yourself at risk for injuries. So when we talk about all of these different things, you're going to wonder, okay, how am I supposed to know how to fit these shoes? So these are some tips for fit here. And the biggest one is go to a specialty running shoe store. Last week, Beth mentioned about Black Toe. The Running Room is one. Anything, anywhere where they've got a good selection and a good variety of all of the different types of shoes that we've already talked about. Because you want to choose the appropriate shoe for your foot type and your training intensity. So you always want to wear socks, and if you use custom orthotics or insoles, make sure that you bring those as well. You want to try multiple pairs of running shoes, and you want to try in both shoes. Obviously, right now, because of COVID, stores have been closed. So if you are purchasing online, just make sure they've got a really great return policy where when you get those shoes at home, you can try them in the house, make sure that you don't wear them outside, and they should be comfortable basically the minute that you try them on. If there's something off, then you've got to send them back and you've got to update them, because if they're uncomfortable the minute that you just wear them in the house, think of what's going to happen after repetitively running in them over multiple days and weeks. In terms of the actual fit, you want to allow about a ½ inch between your longest toe and the end of the shoe. Now keep in mind that your longest toe might not be your big toe. So you want to make sure that there's going to be no way that your toes are going to be jamming into the end of the shoe, causing bruising or losing toenails. Okay. More tips. Basically, it's better to get sized in the evening or try shoes on in the evening as opposed to right early in the morning. Your feet tend to swell throughout the day, and they will swell when you run. So it's better to fit your feet when they're already at their largest size. And if you're in the store and you can run in the store, that's great. A lot of places have a treadmill that you can kind of try them out, and that will give you a really good idea of how they're going to feel. And then the other thing is to be aware of how different brands of shoes fit you. When we talk about, let's say, Nike, they tend to be better for people that have more of an arch as opposed to with a lower foot or a lower arch foot, and that's basically from the last. When we talk about the last, it's really the shape of the outside of the shoe, and you want the shape of the shoe to mimic your foot. You know, if the outside border is really, really flat or really, really curved, you want to ensure that you're using a shoe that's gonna snug and hug your foot. In terms of replacing your shoes, so most people won't know this, but running shoes lose about 30 to 50% of their shock absorption after 250 miles of sitting on the shelf. So sometimes we want to try and cut corners and we think, oh, we'll get, last year or 2018 style, but if it's been sitting on the shelf for 2 years, the shock absorption degrades with time as well. The other thing that you want to consider when you're replacing your shoes is that most running shoes, traditional running shoes, tend to last around the 500-mile mark or 800 kilometers. Generally, that's about every 8 months to a year. Signs that your shoes might need to be replaced are going to include the midsole breaking down before the outsole of the shoe. So you'll start to see cracks and wrinkles and signs of compression that you might not have seen before. And the other thing to kind of pay attention to is, if you're starting to notice discomfort or pain in your feet and your legs, your hips, your back after running, it's likely time for a new pair of shoes. And the same is true if suddenly you're getting blisters or you're getting what we call hot spots on your feet where you've never used to, that means that there's increased friction, there's increased rubbing, something has given way, and there's more movement occurring within the shoe. Now that you've kind of invested all that money, you want to make sure that you take care of your running shoes. So these are some tips that will prolong the use of your running shoes. And if you don't do these, you might find that you have to replace your running shoes a bit more frequently. So the biggest thing is to wear your running shoes only for running. You know, if you're wearing your running shoes out to the store and around, those kilometers count towards the lifespan of your shoe. So you want to consider that. When you get back from running, most likely your feet have been sweating, so just don't kick those shoes off. Untie them and ensure that they can air out properly. The same goes for avoid running in wet shoes. The midsole, if it's wet, it has about 40 to 50% less shock absorption. So if you're running in shoes that have been wet or haven't dried out properly, you're going to lose a lot of that shock absorption that you paid good money for. The other thing would be then to allow 24 hours for your shoes to kind of restore their absorption and dry out. And that gives the midsole time to kind of restore its shape after that wear and tear from the previous run. And, you know, if you're running every day, then you want to have a couple of pairs of running shoes that you're going to rotate back and forth. There's actually a greater benefit to using different shoes because your body gains a slight advantage as it adapts to subtle differences in each shoe design. Rotating your shoes, like I said, will also give time for the midsoles to decompress and the entire shoe to dry out. So for your homework this week, the Learn to Run or the 5Ks, you're going to be, well, actually everyone is increasing their running by about 10%, as Beth had pointed out. So this week, instead of the 2 minutes, you're going to be doing 1 minute of walking and 1 minute of running, and you're going to repeat that 10 times for a total of 20 minutes. And you're going to try for 3 to 4 times a week. And again, trying to leave a day in between runs. Now, our dietitian, Devin Pert, found this free app that she's been using to help with this. It's called Interval Timer. And she said that you can just set the 1 minute intervals and you can repeat it 10 times. And it basically chimes or kind of dings whenever you have to switch. So we can check that out. For the 10Kers, you're going to do 3 runs this week, 4 and 2 5K steady runs for a total of 14 kilometers. And then those that are working towards that half marathon, we've got 4 runs this week, 8K, 4K, 6, and then 10 for a total of 28 kilometers. And again, as Beth had mentioned last week, it's really important to try and follow the 8, 4, 6, 10 rule because it just allows for a little bit of rest in between. Okay. So I'm going to try and see the chats here, and if anyone has any questions, I'll try and do my best to answer it. If you don't get your questions answered, please feel free to reach out and email me. And then next week, we've got Dan, who is our osteopath, going over a warm-up and stretching. Sorry, let me just try and find this. Okay. All right, so Beth asks, do I try shoes on with my orthotics when I buy them? Absolutely. You want to make sure that you can try your orthotics and your shoes on in the store and that they're comfortable. She also asks what causes black toenails. So this is kind of like a rite of passage if you're a runner, you know, you need a black toenail or need to lose 1 toenail. But black toenails are usually caused from ill-fitting shoes, and that can either be too tight or too big because the toe is jamming into the end of the actual shoe, and with running it's repetitive, and therefore it causes a little bit of bruising here and there, and it causes the toenail basically to turn black from the bruise. Is a single pair of running shoes fine for running 3 to 4 times a week? Absolutely. But you also have to consider your goals, right? Like if you're doing speed work, or if you're doing like a long, slow run, then you're going to find that your performance will actually improve if you're changing your running shoes. But generally speaking, for someone who's going out just for exercise, who's trying to increase their endurance, a single pair of running shoes is great. Okay. Next question. What is your experience with Newton's running shoes? I would say not very much. I haven't heard of Newton's. You'll have to give me some more information, or I can reach back out to you if you've got questions. Usually the brands that I recommend are kind of the ones that you'll find most available in stores. So Asics, New Balance, Saucony, Mizuno, Nike, there's Hoka. Those are the big ones that I tend to tell people to look at. The next question, can I still run in the rain if the shoes shouldn't get wet? You can still run in the rain. Just make sure that when you come home, you let them air dry out really, really well before you go to your next run. Karen K is asking, so when you're trying on your orthotics with your shoes, you should be removing the existing insole that's in the shoe and replacing it with your orthotic. Question from John, are there any zero drops other than Ultra? Absolutely. I don't know them offhand, but I can follow up with you afterwards, John, and let you know. From Michelle, is moderate or maximum the cushioning pronating feet should use? Do arthritic toes need moderate or max? I would say if you have arthritis, then you want to lean towards that moderate cushioning. Between the moderate and the maximum, depending on the type of shoe, so whether it's more of a stability or a motion control shoe, that's more about the pronation. But if you're using arthritis, if you have arthritis, then you want to opt for something that has a greater cushioning. Okay. Next question is, what about people with bunions, no orthotics? Is it best to speak to running room experts on fit and balance? So you're talking about running shoes, I assume? Yeah. So if you have bunions, you just want to make sure that you're getting a wider running shoe to accommodate that bunion. For those of you that don't know, the bunion is usually where you get the bump on the great toe. You're going to have a wider forefoot, and you want to ensure that that the shoe accommodates for that. And technically bunions are a type of arthritis, so you also want to opt for something that has greater cushioning. So people with bunions, you really want to avoid running in any type of minimalist or barefoot style shoe. Okay. For a flat foot, pronated foot, what heel drop height would you be looking for? So generally speaking, you want to start at about an 8 to 10 millimeter heel drop height. When you go with a greater heel height drop, it's going to help to take some pressure off of the hind foot. So I would say start at that point, but you can also experiment with maybe, like I said, the 8 to 10 or maybe even 12, 14 millimeters. Okay. Last one, it seems. I've been using the same brand model of shoe for years now. Should I get reassessed and try a new brand model? I would say depends. If you're getting pain, if you're getting blisters, if something has changed and all of a sudden you're experiencing problems, then for sure. But if everything is great and you're running pain-free and you don't have any blisters, then you can just continue with the brand and the model that you've been using. Okay. And then next question, probably not a question for this session, but is it better to run faster for shorter or slower for longer stretches? I'm going to get you to reach out to Beth about that, because we'll just kind of go into a bit more depth so you've got a better idea, because I don't know where you're starting from. Okay. We've got about 5 minutes left, so if anyone had any other questions. So should I use orthotics when running even if it causes foot pain? Maybe until I get used to them. If your orthotics are causing you pain when you're running, then you should not be using them. Usually to break them in, I recommend to patients that you try wearing them just casually around the house or walking before you start running in them. There's usually a little bit of a break-in period that's involved, and running is the most high impact activity there is. So just trying them out right away, it's likely that your feet haven't adjusted to them. That saying, after you've broken them in, and if the pain still continues, then you should just return to wherever you received your orthotics, and there's probably an adjustment that needs to be made. Next question. Is running on a school track and field concrete or grass better? I would say that the track is probably the best option. It's good to switch things up, because it gives your body adapts differently to every type of surface. So if you're always running on concrete, or if you're always running on a track, the minute you switch, you can then increase your risk for injuries. So it's good to do a little bit of each. She wants the homework, so I'm just going to go back. Okay. All right. A couple more here. Homework. Are there any foot stretches that might be helpful for a long run? So Dan is going to be presenting next week, doing some stretches before and after. So stay tuned to next week. Otherwise, you just want to make sure that you're stretching out your calf muscles, especially, oh, thank you, before and after you do your long run, okay? And Beth just said that the homework will be sent out again tomorrow morning, I believe in an email form. Okay. I hope I didn't miss anything. There was quite a few, so that's great. Oh. So does cushioning between 4 to 6 millimeters fall into moderate? Are you talking about cushioning or a heel height drop? Heel height drop. So heel height drop is lower, between 4 to 6 millimeters is lower than the standard kind of 8 to 10. So from Devin, is there a way to tell if you have high arch or pronate besides looking at your shoes? Absolutely. You can be assessed by anyone who's trained in biomechanics. You can see myself at the clinic for a full gait and biomechanical analysis. Also, usually if you go into a specialized running store, they have a great idea. They've got a lot of experience, so they can usually tell how much you pronate and give you some recommendations from there. I don't know if they're doing it remotely right now, Devin. I believe that Beth had mentioned last time about a virtual kind of running shoe fitting, but, or sorry, black toe, but I'm not too sure. Okay, from Daisy, I've been getting calluses on the inside of my left arch from a pair of Asics. Should I consider changing my shoes, or is that normal? I would say it's not normal to get callus on the inside of your arch. It's likely that the shoe might be a little bit like too narrow, and it's cutting you kind of at a place that it shouldn't be, because the inside of your arch is not generally where you should get calluses. So a heel height of 4 to 6 millimeters wouldn't be suitable for someone that needs more cushioning. I'm trying to put the two together when I'm looking at new runners. I would say, Michelle, the heel height has more to do with the way that you strike when you're landing. So if you are that nice kind of heel to toe striker, then you want to stick with something that's 8 to 10 millimeters. If you're more of that mid-foot striker, meaning your heels don't really touch the ground, then you can stick with that heel height of 4 to 6 millimeters. I hope that helps. Oh, and then Dan said that black toe is now open as of last Tuesday. So you can go in and have an actual actually try on the running shoes, which if you can, I would recommend much more than buying multiple pairs over the internet. Okay, it's 12:30, so I'm going to wrap things up. I hope that everyone found that helpful. And like I said, if you have any other questions, please reach out to me via email and I'll get back to you, okay? Thanks very much.